It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I shared a newspaper and also online article about one of our clients with the title "Bureaucrats Withdraw Funds for Disabled Girl's Private Nurse on the Same Day She Saved Her Life." You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to share a couple of articles from the Australian newspaper, further highlighting the dilemma of the NDIS, also known as the National Disability Insurance Scheme, and how it impacts on patients being unable to leave hospital or intensive care, especially when they have medically complex issues such as ventilation and tracheostomy, keeping them in intensive care long term. So the title of this week's blog is "NDIS Leaves Black Hole of Abolished Care Services and NDIS Abandons Disabled to State Hospitals." Rick Morton, social affairs reporter from the Australian newspaper, identified what some of our clients are experiencing firsthand: the relinquishing of state funding for life-saving intensive home care nursing services for ventilated, tracheostomized or medically complex patients in the community. State departments of health across the country are trying to delegate funding to the NDIS, including life-saving intensive home care nursing for either ventilated or medically complex patients who otherwise would be in intensive care long-term or even dead if they didn't have our services. The pitfalls are crystal clear. The NDIS is making no funding available for registered nurses for direct care. Therefore, those patients in essence miss out on life-saving funding and life-saving care, as our latest blog post a couple of weeks ago showed. It just makes no sense whatsoever, as state departments of health will end up paying the bill anyways when patients go back to state government-funded public hospitals and occupy the most expensive bed in a hospital, which are intensive care beds. Or may I even be suggesting that state governments remove funding to save money long-term and let those patients die? Most of our clients are certainly at risk of dying without intensive care nurses coming in the home. Again, as our latest article with one of our clients showed. At the end of the day, a readmission back to intensive care is by far more expensive than intensive home care, period. The NDIS not funding registered nursing support and having potentially support workers looking after ventilated, tracheostomized or medically complex patients is in fact a disaster waiting to happen, will cost lives and has cost lives in the past, a fact state governments conveniently choose to ignore. The dilemma once again is highlighted very well in the articles from the Australian. The first one, "NDIS Leaves Black Hole of Abolished Care Services," and Rick Morton writes in there, "The 22 billion National Disability Insurance Scheme is on a collision course with state and federal agencies over interface problems with other systems such as health and aged care after revelations that a woman has spent 15 months in a hospital bed due to inaction. The case of Julie Hermans, who has been left in Morrock in a New South Wales district hospital in northern New South Wales since October 2016 after contracting atypical Guillain-Barré syndrome and becoming a quadriplegic with a tracheostomy, has highlighted the unfinished work of NDIS design and how it fits with other services. The Productivity Commission last year warned state and federal governments to keep services that don't fit into the disability scheme, though there is little that any level of government can do to enforce this. The interface between the NDIS and other disability and mainstream services is critical for participant outcomes and the financial sustainability of the scheme," it said. Some disability supports are not being provided because of unclear boundaries about the responsibilities of the different levels of government. Governments must set clearer boundaries at the operational level around who supplies what and only withdraw services when continuity of services is assured. Mrs. Hermans is forced to pay $60 a day to stay in hospital after the NDIS ignored a request for accommodation support. While she's only 51 years of age, an aged care home might have been an option of last resort, although none in her area could support her high care needs. Her daughter, Marley Hermans, a 19-year-old university student, says, "It's heartbreaking. It's been so hard. A lot of times I have wondered if I have been pushing hard enough," she said. "The NDIS is almost designed so you can't understand it." One of the key issues in the border dispute between the NDIS and other programs is the loss of advocacy funding, particularly in New South Wales, where almost $11 million is due to expire in July. Advocacy under the new NDIS regime is crucial because these independent voices act as intermediaries for disabled people, yet the NDIS itself was never intended to fund such services. About $40 million in advocacy funding across states and territories will disappear by 2020. This area of interface issues is very problematic for the NDIS, and there are going to be more and more opportunities for arguments about which system pays for what, Disability Advocacy Network Australia CEO Mary Mallett said. "We have heard from our network that interface problems are occurring in housing, transport, health, justice, and we are only in the middle of the NDIS rollout." Writer and disability activist Elle Gibbs received home care support under the old NSW system for a chronic condition, but no longer does. The government sold that, and now it's only available for people with an aged care or an NDIS package, which means people who used to receive support for chronic illnesses no longer do, she said. The New South Wales Community Justice Program, which helps prisoners and people attending court who happen to have intellectual disabilities, is also due to expire this year. State governments and system changes are profoundly disadvantaging people on the fringes of disability far more than even the old system, Mrs. Gibbs said. An NDIS agency spokeswoman said the supply of disability accommodation is in short supply and there are many people seeking appropriate accommodation in this area. The NDIS will follow up on the specific participant circumstance quoted, however, cannot disclose private information. And here is the next article by the same journalist, Rick Morton from The Australian, and the article says, or the headline of the article is, NDIS abandons disabled to state hospitals. The agency in charge of the $22 billion NDIS routinely refuses to fund supported housing for people with severe disability who are stuck in hospitals, arguing they are in a rehab phase. After revealing the case of 51-year-old mother Julie Hermans, who has been left in limbo in a northern New South Wales hospital for more than 15 months, the Australian has learned of a pattern of conduct at the NDIS agency that has affected at least 10 people with no other options. The NDIS will eventually fund about $700 million a year in supported disability accommodation options for people with complex disabilities who can't live alone, but so far just $2.7 million has been paid, while the $1.3 million has gone to consultants for strategic advice. People left in the hospital system are funded by state governments, not the NDIS, a fact that has become crucial in the rollout of the scheme. Mrs. Hermans stranded in a northern New South Wales district hospital after contracting atypical Guillain-Barré syndrome, resulting in quadriplegia and tracheostomy, was asked to pay $60 a day because the hospital said it was no longer appropriate for her to remain there. The New South Wales government yesterday conceded it was privatising all group homes and disability services it previously provided, the last of which will be transferred to the non-government sector this financial year. In a stern warning to the federal agency, a New South Wales Family and Community Services spokesman said its expectations are that the NDIS will provide sufficient support coordination to enable any person requiring accommodation to find a suitable home. A spokesman for Federal Social Services Minister Dan Tehan said the NDIS will work with Mrs. Hermans and New South Wales Health to address any concerns. The interface between the NDIS and existing health systems is complex, and all sides are working to ensure NDIS participants have integrated access to the appropriate supports from all systems. The tension between the systems is symptomatic of a broader design flaw in the NDIS. Little policy work has been finalised as to where the boundaries lies between the national scheme and state systems such as health, justice, transport and mental health. A Productivity Commission review released in October reprimanded all levels of government for withdrawing from services that will not be supplied under the NDIS. In South Australia, yesterday, State Disabilities Minister Catherine Hildyard brought together several NDIS providers to warn that a raft of problems in the scheme, mainly around administrative shortfalls by the federal agency, were causing stress to patients and families. She called on the federal government to fix 9 key problems with the rollout and demanded the NDIS cut its ideological cap on staffing. Mrs. Hildyard said she had written before Christmas to Mr. Tehan but had been ignored. She said providers were continually left to foot the bill because of problems with payments from the NDIS. She said 11 of the 13 regions were still without local coordinators. So those articles really highlight the dilemma of the NDIS. The NDIS really is a minimum viable product, nothing more than that, because especially in the disability sector, especially when it comes to ventilation and tracheostomy, they are actually not disabilities, they are medical issues, and the NDIS is not paying for those issues, which is a big problem, and it could kill patients, some of our patients in fact. So therefore, we urge the Department of Health on a state level to continue paying for the services to keep those patients alive and out of hospital, while the NDIS is trying to simply get their act together. So if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator or with medically complex issues, if you want to know how to get funding for our service, or if you have any questions, please send me an email to patrick@intensivecareathome.com. That's Patrick just with a K at the end, or call on one of the numbers on the top of our website. Also, have a look at our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne, Sunbury and in South Gippsland, Victoria. We are an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator Program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.